we've got a case study. Okay, an 80-year-old man complains of frequent episodes of lightheadedness and feeling like he's going to faint. Right. So that occur only when he gets up from his recliner chair. The episodes resolve after a few moments of standing still. He is currently taking medications for hypertension and benign prostatic hyperplasia. So, which of the following findings would be diagnostic for orthostatic hypotension, that is orthostatic hypotension, in this patient? Options: an increase in heart rate of 35 beats per minute upon standing, not in this case. Next, a drop in systolic blood pressure of at least 20 mmHg within 3 minutes of standing, that's it. Next, a positive Dix-Hallpike maneuver causing nystagmus and vertigo, no. A random blood glucose level of 60 mg deciliter. No, of course, my beloveds, the questions asks about the students to identify. So the question asks the students to identify the specific formal diagnostic criteria for orthostatics or postural hypertension. So a drop in a systolic blood pressure of at least 20 mmHg within 3 minutes of standing. This is the correct answer. So this is a textbook definition of orthostatic hypotension. Why? Pathophysiology. When a person stands up, gravity pulls blood down into the legs. So the body's anatomic nervous system, our body's autonomic nervous system is supposed to instantly compensate by constricting blood vessels and slightly increasing the heart rate to maintain blood pressure and perfusion to the brain. So in orthostatic hypotension, this reflex, but constricting blood vessels and slightly increasing the heart rate to maintain blood pressure is impaired. Diagnostic test. Diagnosis is made by measuring the blood pressure and heart rate first while the patient is supine, lying down, for 5 minutes, and then again after they have been standing for 3 minutes. The official criteria for diagnosis are a drop in systolic blood pressure of more than 20 mmHg, or a drop in diastolic blood pressure of more than 10 mmHg within 3 minutes of standing. So the patient's history is also classic. Symptoms occur only with changes in posture and in position. And he is on medications, antihypertensive, plus alpha blockers, I suppose, for BPH, like tamsulosin, the most common drug, that are well-known causes of orthostatic hypotension. Understand? Okay, why other options are incorrect? What we've got? An increase in heart rate of 35 beats per minute upon standing. So an increase in heart rate of more than 30 beats per minute upon standing without significant drop in blood pressure is the diagnostic criteria for a different condition, a postural orthostatic tachycardia symptomy, which of course is more common in younger women than in love. Next, a positive Dix-Hallpike maneuver. The Dix-Hallpike maneuver is a specific physical exam test used to diagnose benign paroxysmal positional vertigo, so a condition of the inner ear that causes brief, intense episodes of spinning vertigo, but not lightheadedness, with specific head movements. And a random blood glucose level of 60 mg deciliter. This would indicate hypoglycemia, low blood sugar, which can certainly cause lightheadedness and syncope. However, it's not a diagnostic test for orthostatic hypotension. So what is our high-yield takeaway? High-yield takeaway is the diagnosis of orthostatic hypotension made at the bedside with a sphygmomanometer, tonometer, and a watch. So the key is to measure the blood pressure both lying down and standing up to look for the classic drop of at least 20 mmHg systolic and 10 mmHg diastolic. Get it? Good. Stay blessed.